In 2011, women were just as likely to be victims of violent crime as men, according to Statistics Canada data. However, women were victims of different types of crime than were men. In Canada and around the world, women still make up the vast majority of victims of sexual assault and intimate partner violence. In 2011, 6% of Canadian women reported being victims of spousal violence, while 9.6% reported being victimized by someone they were dating. Aboriginal women were 2.5 times more likely to be victims of spousal violence and non-spousal violence than non-Aboriginal women. Women reported 472,000 incidents of sexual assault in 2009. A large proportion of sexual assault cases also go unreported. It is estimated that only about 10% of cases are actually reported, while few result in convictions. Overall, the rate that intimate partner violence was reported to police fell from 36% to 30%. In April 2010, 4,465 women were residing in shelters across Canada. 71% were there to escape abuse. Female victims of spousal abuse and violent crime were more likely to feel fear, depression, anxiety, and anger than their male counterparts. The same applies for victims of sexual assault. These feelings often result from experiences of violence or trauma. Trauma can be defined as an overwhelmingly negative event and as the impact of that event on a woman. Trauma is experienced differently by every woman and can include a range of adverse experiences in childhood and adulthood, such as physical and sexual violence, emotional abuse, neglect, and witnessing violence. Both children and adults also experience trauma as a result of accidents, natural disaster, war, dislocation, and events that result in other sudden or unexpected losses. Trauma resulting from one of or a combination of the above experiences can also be seen as an assault on a person's sense of self, safety, belonging, and connection. Trauma is cumulative, additive, and can be experienced across generations. Trauma can also be experienced via stigmatization because of gender, race, poverty, incarceration, or sexual orientation. Stats Canada data shows that women who had experienced trauma, such as spousal abuse in the past year, reported elevated daily stress levels at almost twice the rate of women who had not experienced violent victimization, and often negatively evaluated their own mental health. Research also suggests that substance abuse is prevalent and co-occurring amongst women who have experienced traumatic events such as physical abuse or sexual assault. Over a quarter of women who had been violently victimized either by a partner or otherwise reported using medication to cope with depression, calm them down, or help them sleep. There is some evidence that immediate intervention following a traumatic experience can be effective in preventing later substance use in female sexual assault victims. When recent sexual assault victims were shown a video prior to undergoing a medical exam that aimed to reduce anxiety by informing them of post-assault medical procedures and describing how to develop healthy strategies for coping with trauma and prevent substance abuse, researchers reported a decrease in marijuana use by participants. However, researchers also noted that sexual assault victims were more likely to use alcohol and marijuana more frequently if they had a prior assault history, reinforcing that the nature of trauma is cumulative and additive, and its effects cannot be addressed by watching one short video. In a study of 6 women's substance abuse treatment centers across Canada, it was found that 90% of respondents reported experiencing abuse in childhood or adulthood. Similar studies also found that experiences of trauma correlated with depression as well as binge eating and drinking. Overall, it is not uncommon for women dealing with trauma to respond to flashbacks, memories, nightmares, and heightened anxiety by self-medicating. When women are referred to substance abuse programs that don't simultaneously address their experiences of trauma, many are met with stigma, told they couldn't be helped, deemed treatment failures, or re-traumatized by practices that are commonplace in substance abuse settings, such as confrontation, but not sensitive to participants' experiences of trauma. In order to simultaneously address women's experiences of substance abuse and trauma, both a gender-responsive and trauma-informed approach to delivering services is necessary. Addicted women frequently experience many barriers to treatment, such as shame and stigma, physical and sexual abuse, fear of losing children and/or a partner, lack of services for women, lack of understanding women's treatment, long waiting lists, and lack of childcare services, along with a lack of financial resources and housing. The role that gender plays in shaping the context in which women live, especially when it intersects with other identity categories such as race, class, ethnicity, and sexual orientation, must be recognized in order to understand the challenges women with substance abuse problems face and develop a trauma-informed approach. Women's increased vulnerability to sexual assault, particularly by someone close to them, and the environmental factors that contribute to experiences of addiction must also be considered. Developing a trauma-informed approach must take the fact that different women respond differently to trauma into account, as well as ethnic and cultural differences. Trauma-informed services must take the trauma into account, avoid triggering trauma reactions or re-traumatizing the woman. Adjust behavior of counselors and staff members to support the woman's coping capacity, and allow survivors to manage their trauma symptoms successfully so that they are able to access, retain, and benefit from the services. Some of the ways service providers can avoid re-victimizing women based on her culture or ethnicity are by avoiding assumptions about a woman's culture, understanding the unique ways in which culture and trauma can be interrelated, such as the experiences of Aboriginal women in residential schools, demonstrating that the knowledge and experience of all women is valued and respected, and working to change practices that marginalize, devalue, and exclude some women. Research shows that women from different ethnic backgrounds both experience and respond to trauma differently. A U.S. study found that African American and Latina women were more likely to experience intimate partner violence in early and young adulthood than white women, and that intimate partner violence was associated with increased use of marijuana and other drugs for white and Latina women, but not for African American women. Findings do suggest that increased drug use by African American women in young adulthood may arise in response to other stressors. The study also found that drug use by African American women and Latina women was associated with experiences of intimate partner violence later in adulthood. These findings are crucial to developing trauma-informed and culturally sensitive treatment services for women. Several factors are key to accomplishing these objectives in treatment. Because women often experience abuse at the hands of those they trust and those close to them, this abuse is often normalized and many do not even realize their experiences of trauma. Therefore, women should be educated about what abuse and trauma are and informed about post-traumatic stress disorder. Treatment providers should take care to emphasize that women's reactions to trauma are normal and to provide coping skills and self-soothing techniques such as breathing exercises. A trauma-informed environment should be a safe, women-only environment that also places an emphasis on establishing boundaries, such as giving permission to receive a touch or a hug, using positive language focused on empowerment and recovery, and harm reduction, allowing women to move on to trauma-specific treatment involving different stages of trauma recovery, such as remembrance and mourning and reconnection. Research on trauma-informed treatment services has found that women utilizing them demonstrate a decrease in both depression and trauma symptoms, were more likely to participate in voluntary follow-up care, and were less likely to be incarcerated than women referred to standard or traditional treatment services. These findings are encouraging for women dealing with trauma and service providers alike.